myomectomy, of course, is removal of fibroids, but it should not impact on hormones, because the hormones don't come from the fibroids, they don't come from the uterus, they come from the ovaries. So if nothing was done to the ovaries, and if the uterus is still intact, then a myomectomy in and of itself does not increase the likelihood of someone entering an early menopause. If you have a woman who's 55 and hasn't had a period in 5 years, she does not need a blood level to tell you that her estrogen level is 0. But when someone is in their 30s and they're having symptoms that may indicate an early menopause, then that is a reason to get some hormone levels, an estrogen level, an FSH level, which is follicle stimulating hormone, an LH level, which is luteinizing hormone. These are pituitary hormones, and that will be your first clue as to what's going on. And if she is still getting periods, then sometimes you need to do those labs more than once, because we know that these hormone levels will naturally cycle depending on where you are in your period. Particularly in women who are already perimenopausal, meaning that ovarian function is already starting to wind down. During the process of an embolization, the teeny tiny little beads that do their work, do what we want them to do in terms of blocking blood supply to the fibroids and therefore shrinking them, can also block blood supply to the ovaries. So we do know that women sometimes will go through menopause a little earlier than they may genetically be destined to do so based on the embolization. That it depends on the fibroid. We know that the larger the fibroid, the less likely it is to shrink, which is so unfair, because the women that are suffering with bulk symptoms, the huge fibroids that are pushing against their bowel and their bladder, those are the women that are the most hopeful that when they go through menopause, that those large fibroids are going to shrink away to nothing, when in fact, while there is some shrinkage, they're not going to disappear. It's the little guys, the little teeny fibroids that can be so troublesome prior to menopause, that are in the lining of the uterus, that very often will shrink away. And quite frankly, at that point, it doesn't matter, because you're not menstruating anymore. So you ask why? Well, the reason generally is the large fibroids have outgrown their blood supply already. Maybe they become a little necrotic, meaning the tissue isn't viable anymore. Maybe they've even become calcified, meaning that they're actual calcium deposits that make it kind of a hard rock-like fibroid. And at that point, changing your hormones is not going to change the size of that fibroid. So it's a little bit of a myth, but not always a myth. The data is inconsistent. The overwhelming amount of data shows that it will not cause your fibroids to grow. And in fact, as you know, and has been pointed out, I'm sure many times in your programs, postmenopausally, even if they don't shrink, they certainly shouldn't be growing. And if they are growing, you want to check it out and find out why. So the question always is, if someone is in menopause and they start hormone therapy and their fibroids are growing, is it the hormone therapy or is it something else? And this is particularly true if someone is bleeding. So as a sweeping generalization, what I would tell women is fibroids in general do not appear to grow with the use of a low-dose menopause hormone therapy, which is what we're doing. Menopause therapy is very low dose. It's not like taking higher dose birth control pills. And that if you are postmenopause, whether you are taking hormones or not taking hormones, if you are bleeding or if your fibroids appear to be growing, don't assume that that's from your hormone therapy. You need to get it checked out, because it may have nothing to do with your fibroids. And if your fibroids are growing, you want to make sure that it is in fact fibroids and not that extremely, extremely rare, but very serious condition called the leiomyosarcoma. And but most experts agree that it is perfectly fine to give hormone therapy to women who have fibroids. And when I say hormone therapy, I want to be clear, what we're talking about is systemic hormone therapy, either in the form of a pill that you put in your mouth, or a transdermal, meaning a patch, a spray, a cream that you absorb through your skin that will help hot flashes, sleep, cognitive function, your bones. This is not the same as using a local vaginal estrogen in the vagina or on the vulva to help with vaginal vulvar dryness or painful sex or urinary symptoms.